toxicology analysis was conducted at a private laboratory and was positive for amphetamines, for which Adams had a prescription, and metragenine, also known as kratom. Kratom is a drug that can be purchased over the counter legally without a prescription and therefore is not a controlled substance. In low amounts, kratom works as a stimulant. In higher quantities, it can have an opiate effect and can be used as an opiate substitute. There is no approved FDA use for kratom. During our investigation, it was learned that Phillip Adams played professional football in the National Football League from 2010 to 2016 and suffered injuries during his football career. In interviews with the Adams family, we learned he endured several concussions, which is known to lead to chronic traumatic encephalopathy, commonly referred to as CTE. According to the family, Adams complained of excruciating pain from his injuries, often had memory issues, and difficulty sleeping. For this reason, Boston University was contacted and asked to conduct advanced brain studies to determine if CTE could have played a role in the incident. On Tuesday of last week, Boston University contacted my office to discuss the findings of the study. I'm going to turn it over to Dr. McKee and let her talk to you about the study itself.
Thank you, Sabrina. I am Dr. Ann McKee, Distinguished Professor of Neurology and Pathology at Boston University School of Medicine, Director of Neuropathology at VA Boston Healthcare System, and Director of the Boston University CTE Center. I speak for my entire team of investigators at VA Boston and Boston University in saying we are deeply saddened by the events that occurred last April, and we continue to pray for the families of the victims. I conducted the neuropathologic examination on Mr. Phillip Adams. Phillip Adams had frontal lobe atrophy as evidenced by enlarged frontal horns of the lateral ventricles. He also had a large cavum septum pellucidum with atrophy of the fornices, and microscopically, he had very dense and extensive tau pathology in a pattern and distribution diagnostic of stage 2 CTE. CTE is a progressive degenerative disease caused by repetitive head impacts. And although that can include concussions, much more importantly, it includes subconcussive hits, the smaller hits that often do not cause immediate symptoms. We have diagnosed CTE in 700 individuals, including over 315 former NFL players. Adams' 20-year career in football put him at high risk for the development of CTE. CTE is a progressive disease that worsens with age, although in many instances, as this one, it is a disease of the young. We have diagnosed CTE in 24 NFL players who died in their 20s and 30s, and most of those football players had stage 2 CTE. Stage 2 CTE is associated with progressive cognitive and behavioral abnormalities such as aggression, impulsivity, explosivity, depression, paranoia, anxiety, poor executive function, and memory loss. Mr. Adams' CTE pathology was different, however, from the other young NFL players with CTE. It was different in that it was unusually severe in both frontal lobes. In its frontal lobe predominance, Adams' CTE pathology was similar to that of another young NFL player, namely Aaron Hernandez. Severe frontal lobe pathology might have contributed to Adams' behavioral abnormalities in addition to physical, psychiatric, and psychosocial factors. Theoretically, the combination of poor impulse control, paranoia, poor decision-making, volatility, rage, and violent tendencies caused by frontal lobe damage could converge to lower an individual's threshold for homicidal acts. Yet such behaviors are usually multifactorial. And now I'd like to turn it over to Lisa McHale.
Thank you, Dr. McKee. I'm Lisa McHale, Director of Legacy Family Relations for Concussion Legacy Foundation, and I'm here to read a prepared statement by the family of Phillip Adams. As we process these results, we are deeply saddened by the events that occurred on April 7th, and we continue to pray for the families of the victims. We are pleased to have a better understanding of the mental turmoil that Phillip was dealing with during the last moments of his life. We cannot say that we are surprised by these results. However, it is shocking to hear how severe his condition was. After going through medical records from his football career, we do know that he was desperately seeking help from the NFL, but was denied all claims due to his inability to remember things and to handle seemingly simple tasks, such as traveling hours away to see doctors and going through extensive evaluations. We now know that these deficits were most likely caused by the disease. By participating in the research process, we hoped to bring awareness to this condition so that players young and old can understand the risks. We will continue to advocate for any research that can prevent any other family from having to endure this type of tragedy. We want people to understand that this could happen to anyone. Phillip is not the first to battle with this disease, and he will not be the last. Thank you so much to Boston University, the Concussion Legacy Foundation, the VA, and all of the folks that have helped us and many other families to get these much-needed answers. With that, I'll turn things back over to Sabrina.
Thank you, Lisa. One of the most frequent questions that I am asked by those left behind is why. As a medical legal death investigator, my primary objective is to determine the cause and manner of death. In some cases, I'm able to answer the question of why, and in other times I cannot. Although it is felt that the findings of this study do not in totality give us the why of what happened on April 7th, it does give us a small piece of a more complex puzzle that is still under investigation. Prior to scheduling this conference, I met with the victims' families, as well as the Adams family, to discuss the findings of the study. The Adams family asked that I read this statement on their behalf. On behalf of the families of Robert, Barbara, Ada, and Noah Leslie family, the Leslie family. We would like to offer the following statement regarding the CTE analysis. These 8 months have been unimaginably difficult. Even in the midst of crushing heartbreak, we are finding some comfort in the CTE results and the explanation they provide for the irrational behaviors pertaining to this tragedy. We are grateful for those working to continue to shine a light on anything that can prevent this kind of nightmare from happening to other families. Those who sow with tears will reap with songs of joy. Those who go out weeping carry seed to sow, will return with the songs of joy, carrying sheaves with them. Psalms 126, 5-6. Thank you for your prayers of support. We continue to grieve as those with hope. Lori Alexander, Amy Kalbuck, Robbie Leslie, and Jeff and Katie Leslie. Just a few moments ago, I also received a statement from the Shook family that I would like to read for you as well. Holly Shook and the Shook children continue to grieve the loss of Robert, a devoted husband and beloved father. Holly hopes to find answers that will prevent similar tragic outcomes. We would like to thank you for attending today. We will take some questions from the folks present here at this time.
I wanted to ask Andrew Dice, the Herald and this would be for both you and Dr. McKee. She said it was stage 2. For our readers who are lay people, where does that stand on the scale, and is it, can we say with definity that the lesions and damage to his brain came from his football career?
Dr. McKee, I'll let you have that answer.
Okay, thank you. So stage 2 CTE is on the spectrum. There are 4 stages of severity. 4 is the worst. But it is a disease that worsens with age. So we usually see stage 3 and 4 in much older individuals. Philip was 32 when he died, and this is entirely consistent with his level of CTE. Unusually, though, his frontal lobe pathology was much more severe than we usually see in stage 2, and it was bilateral.
With, this kind of behavior, this silent behavior, would that alone cause them to act in this manner, or would there be other factors?
Dr. McKee, could you hear that question?
Yes. So we have seen this behavior. We've even seen homicidal behavior in other individuals diagnosed with CTE. It's difficult to say that it alone resulted in these behaviors because usually it's a complicated issue with many other factors. But certainly we have seen this behavior and it is in fact not what I would consider unusual in this disease.
Yes, ma'am.
Brittany with Watchbox here. Is there anything football players can do to kind of reduce this risk of getting CTE, or is it just kind of a consequence of sport?
Dr. McKee, I'll let you use that.
Well, reducing the number of years playing football is probably the number one thing they could do, starting to play later, reducing contact in practice, skill development so that there's less head contact and based on their style of play. But intrinsically, football is a collision sport, and head contact is part of it. So the best way to avoid CTE is to monitor the number of head hits an individual sustained and try to keep those to a minimum. That really hasn't been addressed by the major sports leagues. No one is keeping track of what these players are exposed to, and I do think that is imperative for us to prevent this disease.
Dr. McKee, there's a question in our chat from CN2 News. Would someone snap with this disease, quote unquote snap, to lead to this kind of event? Would it be clear the signs of someone's capacity to do this ahead of time?
Well, it's very difficult in an individual case to say that, in this particular case he snapped. There were inklings that he was developing clear behavioral and cognitive issues. I don't think he snapped. It appeared to be a cumulative, progressive impairment. He was getting increasingly paranoid. He was having increasing difficulties with his memory, and he was very likely having more and more impulsive behaviors. So I think he lived largely by himself. It may not have been recognized, but I doubt that this was entirely out of the blue.
You're at Stevens behind the scenes in Charlotte. This is for the sheriff and the coroner. Do you know why Phillip Adams targeted the Leslie family or went to that home in particular?
We don't have any indication as to why. They lived in close proximity to each other, and that's the only connection that we can make. We don't know if there was a personal relationship between Dr. Leslie and Mr. Adams. We do know that the children did not have any contact or any knowledge of Mr. Adams.
And there's no documentation that he was actually a patient of Dr. Leslie's either. Yes.
This is Savannah Rudisell with Fox 46. Question for Dr. McKee. Is there any kind of research being done to be able to identify CTE in people who have significant head trauma before you get to an autopsy?
Yes, actually, that's the holy grail of our research, to identify this disease in the living. That will completely change everything we know about this disease. For instance, we can't use any therapies that we might have in our arsenal against this disease because there's no way to monitor whether they're working or not. So there's huge investigation from multiple centers throughout the world looking at ways to diagnose this disease during life. We're looking at biomarkers, blood biomarkers, spinal fluid markers. We're looking at imaging, scans of the brain for uptake of tau. There was a recent report from our center looking at something called FLAIR MRI and structural MRI. And those can give us clues that the person is possibly suffering from CTE. But we do not, as of yet, have a definitive biomarker or way to diagnose CTE in the living. And that is absolutely what we are hoping to do with this research.
Yes. Ken Lemon, WSOC TV. Hearing what you just said and hearing what the family, Mr. Phillips, has said about this, it sounds like there are alarm bells that ring throughout the NFL, not only about what happens to players during the game, but the treatment they may receive after the game. What does this tell you about what should happen going forward?
Well, I think for in the very least, a player that's having difficulties, a player that is experiencing what Mr. Adams was experiencing, he tried to get help. But this is a man who is not thinking clearly. He's having problems with planning and organization. He's the least able to actually get help. There's huge obstacles for these former players to find help. They have to make many medical appointments. They have to fill out very extensive paperwork, and that is usually beyond the ability of people who are impaired. If they don't have an advocate that's recognizing the issues in these individuals, they fall through the cracks. And that, I think, is what happened for Mr. Phillips. So I would like a comprehensive care package, evaluation system offered by the NFL for these ex-players that would give them the kind of care and management that they deserve.
Let's take a question off the chat box here. Amy from Boston Herald. Once someone is showing signs of CTE, are there therapies or other things people can do to mitigate the effects of the disease?
Yes, thank you. We don't have specific treatments for CTE. As I mentioned, there are some potential therapies out there, but we can't use them if we don't have a way to monitor them. Right now, the treatment for CTE is symptomatic. So if they're depressed, antidepressants. If they're having trouble sleeping, different sleep therapeutic strategies or medications. So it's symptoms, responding to the symptoms. And also, but these people need to be followed and cared for. They need to be evaluated over time to give them that sense that they're not losing their mind, or that this is not just something that's within them. This is actually a disease that's impairing their ability to function. Some of the things that you can do to mitigate the effects of the disease are just maintaining high cardiovascular fitness, because there's such a connection between brain and heart. Cardiovascular fitness improves brain health. People's symptoms improve with cardiovascular fitness. So that's something that we all can do improve our brain health no matter what our particular difficulties are.
Robin with Fox 46. Are the amphetamines in the kratom, is there any significance to those?
With the amphetamines that were found, he had a prescription for, so we expected to find those. Kratom is a non-FDA, has no FDA-approved use, and like I said, in small doses it can be used as a stimulant, and in higher doses it can have an opioid-like type of effect. We certainly didn't expect to find it in his system because at the time we didn't know that to expect it there. Really don't know what role, if any, that actually played in the event. Yes.
Ms. Gass, I'd like to follow up on that question. First of all, if he had paranoia and depression and all these other symptoms, why would he be prescribed amphetamines, which generally would be an upper? And the kratom part, is there a known reaction between amphetamines and kratom that could have caused some kind of catalytic or some type of catalyst activity that pushed him to do this, what he did on that day?
I know that he had a long-term prescription for the amphetamines. I do not know. I'm not a forensic toxicologist, and I certainly do not want to address the symbiotic effects of kratom and amphetamines. That's out of my wheelhouse.
When you say long-term, how long? Do you know?
I do not know at this point, no.
I have a question for the sheriff, if I may. Sheriff, again, Andrew Dice with the Herald. Can you talk about the status of the investigation now that the suspect, the term that you use, is deceased, so he cannot be charged under South Carolina federal law with a crime? However, are you going to continue to investigate this with your team of detectives as people want to know that question, which is why did this happen?
So, yeah, I'll speak a little bit on that. We've answered the what happened, the who did it, the how it was done, where it was done, when it was done, obviously, and so that only leaves the last W of the why. And we are nearing conclusion of the evidence that we have. We did take some somewhat incoherent writings in notebooks that we believe to be Mr. Adams's, with just some, the best way to explain is just incoherent writings. Those are at the FBI. We initially sent copies. Those copies, because some of the writing is so small, those copies were not sufficient for their examination. We actually have investigators in Quantico right now with the Behavior Analysis Unit looking over those writings and trying to determine some sort of conclusion of what makes sense. Once those writings have been examined by the BAU, we should be concluding our investigation as to the why. And let me point out that law enforcement is not necessarily used to answering the why. Sometimes the why is obvious. I think what we have here is a big puzzle with multiple victims, multiple facets of potential motives, for lack of a better word, and the kratom is maybe one piece of the puzzle. The CTE may be another piece. These writings may be another piece. But as 30 years law enforcement officer, sometimes we get to know the why, sometimes we don't. My guess is there's one individual that knows the why. He is deceased, and we may not know on this life, in this planet, what the why is. While I've got the floor.
I have one more question,
okay.
if I may. Can you talk about the weapon or weapons that were used, A, and B, the other weapons that were seized both at the home on Marshall Road and previous to that in Charlotte by North Carolina law enforcement?
I don't recall the actual weapons as far as the model and the make. I do know they were at the Leslie House. It was mainly 9mm, high capacity, And I cannot tell you, I'd be glad to follow up, but I cannot tell you the number of weapons seized from Mr. Adams' home. I will tell you it was numerous. And when I say numerous, I will probably tell you 20 plus of different makes and calibers. I would, characterize someone with that type of ownership of weapon as, somewhat of a enthusiast. It's not uncommon for people in York County to own multiple weapons and be very enthusiastic about the different types of weapons. I do want to say one thing also. I hope that we're all cognizant that there are multiple families here who are in the healing process. I cannot imagine either from the Adams or the Leslies or the Shooks or the Lewises what this experience has been like. At the end of the April 8th press conference that we held, we expressed the request from the Leslie family for their privacy. That request was not heeded by some members of the media, and I don't know if you were here or not. That request is being repeated today. The request, the April 8th request, was only heeded after a number of requests from our office and our PIO to members of the media who continually ignored it. The Leslies have posted their property with trespassing signs. I have deemed that to be properly posted and within the bounds of the law. And so the notice today is right here. If you step on the Leslie property against their wishes, you will be arrested and you'll be charged accordingly. Please respect their privacy. And if the Adams family requests the same, we will grant that request to them.
Time for one more question if anyone has any. Andrew?
I have one more question for Dr. McKee, or any of you for that matter. She mentioned other NFL players. She mentioned one by name who was involved in, I believe it was homicide. I don't follow the NFL super closely. But is it also not fair to say that many of the, or most of the CTE diagnoses that were made on former NFL players did not end with homicide or someone being shot?
Yes, that's absolutely true.
So is it fair and right to say that the actions of Phillip Adams, the suspect, were an anomaly versus what normally happens with people with stage 2 CTE?
Yes, it's unusual. However, he had an unusual amount of pathology, unlike most people with CTE 2, in that there was a considerable amount of frontal lobe damage.
All right. Thank you for joining us today. We hope that we have been able to answer some of your questions. Please